Okay, so we will take the temperature. Now, normally it should be less than 39, and if it's less than 39, there is no fever. So we see what's the temperature. Now you can hear the guinea pig having this sound, and this is not normal. Normally they don't have sounds. So okay, take the temperature, and of course you need some time to take the temperature, and it should be how many? 38.7. Okay, so that should be okay now. Now I will do the physical examination now. Now the physical examination, we observe whether it's active or not. It's still quite active. It's not lethargic, not too lethargic. Okay, so now I go through quick the torchlight and check with the eyes first. Any eye discharge? No. I see some congestion of the conjunctiva. Quick look here. Any eye discharge? No. Nose discharge? No. Okay, then I'll have a quick look at the mouth. The best is to have a forceps. Okay, have a quick look. Ready? Open. Now check the tongue. What color? Pink color is okay. Now it doesn't like me to open the mouth. Now just now she was eating the cardboard, so there is some cardboard inside. Okay. Now, overall it looks alright, the mouth, the eyes and the nose. So now I will just do a quick palpation. Now here is a pain, see? And here. So I don't press now, I press the rib cage. So the pain is definitely on both sides. Okay, so have a quick auscultation, stethoscope. I can hear the cries, yeah. The heart rate is very fast. Now whether there are lung sounds or not. So you differentiate between the lung sounds and the cries. There are some lung sounds, but could be due to the fast breathing sounds. The guinea pig is very uncomfortable when I press against the chest. So that one is more or less you can come to a diagnosis of traumatic injury to the chest. Now I go to abdomen and I check for pregnancy, whether she's pregnant or not. So have a quick palpation with thumb and forefingers. Of course, she could be early pregnancy, but she's not very happy with it. So now you can feel for fecal lumps, the small fetus, but I don't feel anything. But there's still some pain as well. Yeah. Okay, now we turn upside down. Have a quick look. Any injuries or not? Now this one is really look as if she had given birth before. These are the nipples. And have a quick look here. Any vaginal discharge? No. There's some redness there. There's some inflammation. Other than that, it's okay. Now the stool is here. This stool shows that she still is having a normal stool, no diarrhea. Okay, so that is the stool. So overall, the possible diagnosis is based on the signs and symptoms. The signs and symptoms is actually pain. Pain in the chest area and also a bit in the abdominal area. So there's a male guinea pig that is about 1 kg, bigger than this female. According to the owner, the female likes to climb over the male, mounting the male. But in this case, I suspect the male must have mounted on the female and accidentally injured the chest and abdomen, and we will send for an X-ray. X-ray is more to see whether there is pneumonia or not, or fluid in the lungs and the abdomen. Other than that, we will put it here for about 2 days and see whether they can collect urine to check for kidney infections. For guinea pigs, we seldom take blood tests for the checking of the blood values because the amount is too little. So basically, we are based on the history and the observation of eating the food, the stools and the urine when we what it in for 2 days. So that is the end of the examination. Okay.